I'm often asked why a certain facelift looks more natural than other techniques. And I think there are a lot of components to that. First of all is the design of the incision. So I think it's very important to make it so that the incisions are as discreet as possible. So some surgeons will make an incision right in front of the ear, and I frankly think that's very noticeable. And ideally, you'd like to have a series of short curves that hug the ear, that go behind this piece of cartilage that's in front of your ear canal, so you don't see that part. And you go around the earlobe and into the hair, not along the hairline and the neck, because I think that's noticeable. And you want to make sure that the earlobe looks completely natural afterwards, like it's not attached to the cheek. And you want to make sure that the incision around the hair here also looks natural and that you haven't pulled this hair back that creates sort of a bald spot. Those are telltale signs of a facelift. And then in terms of the overall aesthetic result, you never want to see something that looks excessively pulled, and you don't want to see something that looks sort of horizontally pulled, where the mouth is stretched out. So really, the vector, as they call it, has more of a vertical component than a horizontal component. So it's actually perpendicular to the fold here. So the direction is sort of more up than just back. And then the technique is extremely important. So these days, the busy facelift surgeons are doing the deep plane technique. And the deep plane technique does give you the best long-lasting, natural-looking results. And there's frankly a reason for it. So when we do the deep plane, we're not relying on pulling the skin to get the aesthetic result. What we're doing is we're getting underneath what we call the muscle layer relatively soon, relatively quickly after lifting up the skin through the incisions. And then when we're underneath the muscle layer and we're in a space we call the deep plane, it's very important that you have to release a series of attachments. There's sort of 4 clusters, a couple here, one here, and one on the side of the neck. And those fibrous attachments are tethering the soft tissue. So you have to release those attachments, and then you're very easily able to lift the jowl, the skin and the jowl together, and you're not having to pull on the skin to get the lift because you've released those attachments in the deep plane, so you won't look pulled. So other surgical techniques that don't release in the deep plane, they're often having to rely on a certain element of skin pull to get their lift. And that's why those people can look pulled when they're, talking, when they're moving, when they have certain facial movements, it looks a little bit off. So the advantage of the deep plane is that you're moving all of the skin and soft tissue sort of as one unit, and you're not having to apply tension so they don't look pulled. And then even when we remove the extra skin around the ears, because we've released those attachments in the deep plane, when we put the skin edges together, they're not pulling apart. They're not under tension, so that the incisions heal better and it's much harder to see them. So all of those components go into a natural looking deep plane face and neck lift. Some other things that we'll do is we'll sometimes use your own body's fat that we take from just underneath your belly button with a micro liposuction technique. We put it in a centrifuge. We isolate the fat cells. And then we'll put very fine strands of fat in areas where there might be some hollows, where there's a loss of volume, say in the cheeks or in the folds or the corners or along the jawline. And it's a very sort of artistic sort of finesse to the facelift so that you get natural looking results because you're adding volume that you may have lost. Now, it's important not to use too much fat because when you use too much of anything, it looks unusual. So that's where the sort of aesthetic eye of the facial plastic surgeon is very important. What is it that looks natural to both the patient and the surgeon? And that's, ultimately the most important thing.